No, my
All
favorite is Marvel,
Marvel.
and
Oh, I know
if there was a
Marvel.
PhD, I think there is a PhD in Marvel and DC.
The full family will get a PhD.
From the beginning, I never forced my kids to enter the medical.
Same here.
ये नहीं बोलते
हाँ, इन्हें बोलते
ये नहीं
हैं
बोलते
वो politically correct करने का.
इसको पॉलिटिकली करेक्ट कर नहीं सकते.
Hi friends, welcome to a podcast, the first episode of Consultants on Couch. I am your host, Dr. Divyesh Ravesia from Sujay Hospital in Juhu, Mumbai. The purpose of this podcast is to let the listeners get to know their own doctors, know how, why, and the reason they are the person that you come across. More human, more next door. And we want to introduce the doctors so that you know them better, their strengths, their weaknesses. The first guest on our podcast is Dr. Samir Pilankar. He's an orthopedic surgeon of great reputation. He's recently received the Abdul Kalam Award for the best orthopedic surgeon. He's been on the top 10 list of orthopedic surgeons in Mumbai and many more academic accolades. His specialty being knee surgery. He's now mastered robotic knee surgeries and has a lot of numbers to get the right kind of results. His other specialty is arthroscopic surgery, and he's got special skills in minimal invasive laser arthroscopic surgeries. Welcome, Samir, and thank you for sort of being here and helping us out with this podcast.
Thank you for the generous introduction. And at the outset, let me thank Sujay Hospital for giving me the opportunity to share my thoughts about my journey and how we look at the patients and how we treat them. And also it gives me a chance to maybe inspire some budding doctors who might want to take up joint replacement, orthopedics as their vocation.
Well, that's very kind of you, Samir.
That is my take on these talks. And also the patients, if they are watching this, might understand what makes us tick and what makes us strive to give the better results. So without further ado, I think we can go ahead with the
No, that's very nice of you, Samir. And so basically, let's keep this talk very informal.
Yeah.
Not too much of academics. It's more for the listeners to know your background, to know what makes you tick and what exactly and how you got to this phenomenal place in your career that you are at present. Let's start with your undergraduate days. Can we sort of discuss? Most of us, the foundation of our career or what we are starts from undergraduate. Just let us know a little bit about where you studied, what inspired to become a doctor, any mentors or anything.
See, before undergraduate days were fantastic. I was in KM Hospital, which is gets the cream of the medical students. But before I entered KM,
Well, Nair is better.
we can agree to
So
disagree.
we've always had
We can
this
agree to
rivalry.
disagree. My wife is from Nair, and
See, told you.
she every day tries to fight with me on this particular topic, but I think she has resigned to the fact that KM is the better hospital. But
I would agree. I would actually agree.
We can agree to disagree.
Yes. No, I agree.
So at our time, it was having the best academics, and we had stalwarts who were teaching us and dedicated teachers. But before my KM days, I would like to take you further back during my childhood, where the first spark to become a doctor came.
That's interesting.
So as long as I remember, I always wanted to be a surgeon. Maybe it is the books I read, the movies or whatever, the general atmosphere at that time in 70s, 80s. Everyone wanted to be a doctor. I personally, I wanted to be a surgeon, because for me the surgeon was the captain of the ship and used to just turn the whole situation around. From a dying person, used to fight and get the person back on his feet. So I wanted to be a surgeon, and our atmosphere at home, I grew up with my grandma, because my parents were staying in Goregaon. I was in Dadar near my school, and these were the three main influences on my sort of childhood to get my grounding. My grandmother and my parents all were educated, and the atmosphere was sort of educational atmosphere in the home, and we had access to all kinds of books, and we are always encouraged to question everything, and that's how I developed my scientific temper. So towards my 11th 12th, I was very sure I wanted to become a doctor, but there was only one small issue. I was very good in maths and physics also. So at that point I was in a dilemma.
Engineering was the
Yeah, I
pressure.
was in a dilemma whether to go into engineering or to become a doctor. But at that point, I listened to my guts and my heart, and I felt I should become a doctor, which was my original calling. So I entered KEM, and
Just let me interrupt you. Are your parents doctors? What do your parents do?
no,
Was there
no.
pressure for them for you to become an engineer or a doctor? In our times it was always doctor, pilot,
Yes, yes. Our time
engineer.
we had only two options, basically engineer or doctor, and my parents both. My father is a PhD doctor.
Oh.
He has done his PhD in biochemistry.
Oh,
So he had.
excellent.
So we used to discuss about biochemistry and pharmacology at home, and my mother worked in post and telegraph, and as I said, we had access to all kinds of books, and the atmosphere was good. And at when I entered KEM, in the first 2 years, I was still very unsure whether I made the right decision. And then I got introduced to orthopedics, and that was like love at
Game
first
changer.
sight. And it was the perfect. I feel orthopedics is the perfect marriage between physics and biology.
And maths with a lot of
maths,
calculations.
maths also, because physics has maths.
Yeah.
And so I wanted to pursue orthopedics at that point, and there is no looking back after that. I ensured that I got into orthopedics in the best institute at that time, which was Sion Hospital, which had the cutting edge technology and teachers at that time. We had Dr. Nandu Lad, Dr. Ingal Alikar, Dr. Joy Patankar,
Oh.
all stalwarts, and we learned the
So
best.
Joy Patankar was
In-
an orthopedic. I
he
thought he
was-
was a surgeon because Roy is...
Roy is a surgeon.
Yeah.
Joy is his brother, who taught us lateral thinking in orthopedics.
nice.
He never asked us to go by the
Books.
books and the trodden path, and we were taught to think outside the book and use your intellect to deal with each particular ailment.
Great,
And
great.
again, the atmosphere in Sion was good, and it was like a commando training. After working in Sion, I can proudly say I can work 25 hours a day and 366 days in a year without tiring.
Which you actually do.
Which I actually do. So that is my Sion training, which has made me like a commando. We can.
I think all municipal hospitals
Yes.
in Bombay have trained all of us.
Yes.
And I
That is
think
true.
so. Just one very important thing from your childhood: what should the parents or undergraduate 11, 12, 9 boys or girls who want to get into medicine as a career, what do you think should be the skill set? What should be the aspirations, and how does one parent somebody to become a good doctor?
See, I have both of my daughters are into
I know
medical.
that's why I'm asking
Yeah.
you. My two children are doctors, but for the listeners, it's important.
Yeah.
We because we are doctors, our children have seen us and become doctors. But if somebody aspires to be a doctor, what do you think
Yeah.
one should do?
So from the beginning, I never forced my kids to enter the medical
Same here.
profession. I kept them open to choices. So and they were exposed to all sort of specialties, even maths and other extracurricular options were also open to them. But for some reason, because they feel doctors
get
are glamorous, they get obviously influenced by the standing in society and the work we do and the satisfaction we get from our work. and that is how they get influenced. For non-medico parents, what I would suggest is, if your son or daughter wants to enter medicine, they should have a real passion, because medicine is not a
It's a
part-time
grind.
profession. It is
It's a grind.
sort of a lifetime thing which you do. It is not something which you can do
So you were
part-time.
married into orthopedics, I'm
So
married
my-
to surgery,
yeah,
and that becomes a first
My wife
action.
always
Yeah.
says that she is my second wife,
Yes.
and orthopedics is my
But-
first wife.
So three or
So she always cribs about that, but I always take it as a compliment. I say it is my
that's my profession.
It is my
Yeah.
profession. And it's
You
my
love it.
first love. It came before you, so it is my first love.
yes, that's very
So
true.
if the child is really passionate to pursue, I have seen many kids who are good in academics, but they are not trained to undergo the grind of medicine. But medicine is hard. You require to put in your blood, sweat and tears into it.
Very true.
So it is not something which you can do part-time, and without passion they fizzle out. Even if you are good in academics,
So let me summarize. You from your, it has to be a passion, not a career.
it is not a career. Medicine is not
passion.
a career. It has to be a passion. As I said, you put sweat, tears and
dedication.
blood
That's
into
true.
it, so that you excel in it. Excellence in a particular, in medicine at least, is a byproduct of your passion. If
well
you
said.
if
That's
you have
well
passion for the work, you enjoy your work, and automatically everything follows. Money, fame, results, everything follows.
One
But
one
you have to have a
brief
passion.
opinion on the present medical education NEET system. Do you have anything to say? Your personal opinion
I think
on the
it
NEET
will,
and the undergraduate at present.
Yeah, it will take another podcast for it.
Okay.
But let me just summarize
Yeah,
my
just, your
brief
philosophy,
thoughts about it. NEET, at the moment, I feel it is better than what we had to undergo. We had just one shot in 12th, and it was a make or break. In case you had a bad day, your supplement gets
Oh,
lost,
never realized
something like that, you end up at the bottom half. And then that is the
there's
end
no
of
option.
it. These are fixed onto your forehead, and that is what you go ahead with. But unlike that, in NEET you get multiple attempts.
Chances.
And in case you don't perform one at first time,
You
you
can
can
reset it.
again always give it at the second go, third go, and maybe get a better result. So that safety net is there in NEET. Having said that, I feel NEET can can improve. I go by the Kaizen principle. So nothing is perfect, and everything can be improved on.
You have to work hard on it.
That is same with NEET. NEET can improve. Only thing they have to make it a bit more tougher. You have to separate the chalk from the cheese. You need to separate out the good students from the very good students, from the mediocre students. So that is only possible if you give a bit tougher NEET exam. Present NEET exam is very simple. It has there dumbed down the NEET exam, and everyone gets above 650. That is not fair to the hard-working students.
Everyone gets 650. I know your
Everyone-
daughters did.
Everyone gets. That means the
They
most.
need to up it.
Yeah, you need to
More
separate.
like an IAS, IPS
Yeah, you
exam.
need to stratify the students. You can't have so many students getting full marks. It is not normal. It is not correct.
Any incident in your undergraduate days that got you frustrated, that well, medicine is not for you, or you didn't want to pursue it? I had a tough time in my second MBBS too. You know, it was just sometime, you know, morals go down and you say, oh, what am I doing here? What? Any incident that put you off medicine, or some hard decisions or something that went wrong? Because undergraduate days are tough for us.
Yeah, undergraduate days were actually the best days in my life. One of the best days. Present days are the best days. The days in undergraduate were really good, and looking back, we always have this gold-tinted vision of the past. But I can say, as a third person, that they were one of the best days of my life. And as I said before, also first 2 years I was a bit unsure. I said maybe I should have taken up engineering, because
That's true.
I had got more marks in PCM than PCB,
Oh.
but the satisfaction after treating, even as an undergraduate, was really satisfying. And I was always a bright student. I got 4 distinctions in my undergraduate. I was always in the top 5, and so I had no reason to complain actually my undergraduate days.
There are always stories when all doctors get together. I mean, especially our colleagues, our friends from the same school, college. There are always stories about ragging, teachers, friends, heartbreaks. Anything that you would like our viewers to sort of any notable incident that will tell you? I mean, especially all of them will be interested in any heartbreaks or any ragging or teachers or somebody.
See, ragging was always on top of, but the top concerns when I joined medicine, I had heard horror stories about ragging, but
Doesn't happen anymore.
doesn't happen anymore because my daughter is in KM, and there's zero ragging there. When I entered KM, there were a few incidents in the previous year, because of which they had really caught down very hard on ragging, and we were not hostelites. There were some incidents in the hostel,
And the hostels were
but
different.
we were doing up down from our home. We were staying in Dadar, and so I did not experience any ragging, fortunately or unfortunately, I don't know. But about heartbreaks, I was
Everybody's interested in that.
yeah,
Samir.
but sorry to disappoint the viewers.
You were into books, your
I
passion.
was into books, and there was no Tinder that time.
Now let's jump to I know that you've done your post-graduation in orthopedics, that's MS orthopedics, and then you achieved skills in arthroscopy, spine, shoulder arthroscopies, robotics, and you were trained abroad.
Yes.
Especially Germany, which is your
Germany
most
is my
favorite
first
country.
love, and because the Germans are really nice, welcoming, and they don't hold anything back, unlike the other European countries. My boss in Dusseldorf especially was fantastic, and he made it a point that I operate most of the cases, and he assisted me, and
Nice.
we had even now we converse at regular
So how
basis.
long were you there in
I was
Germany
there
for
for a year,
Oh,
and
nice.
Dusseldorf, if you have been to, is a
I've been to
fantastic place with a great river and old buildings and
The
everything.
entire Germany
Like entire
is
Germany.
beautiful.
And that particular place had a mix of arthroscopy as well as joint replacement. So I was exposed to both, and they used to do huge number of joint replacements and arthroscopies. Every day the list used to be running into 7-8 cases. So great exposure, and I'm always indebted to Dusseldorf training. And after that, I was honorary in Cooper Hospital.
Yes, I'm coming to
And,
that. I'm coming to that.
There also we had excellent rapport with my colleagues, and also, as you know, Cooper has the huge volume of our patients, and so
So
that helped.
would you ever think that you've been to Germany, you travel abroad, and you've been to a lot of places as a student, as a teacher now, you go to Far East and teach arthroscopy, you've been to a lot of, how much time would Indians as India take to develop into that level of sophistication, care, developed nation? What are your views on medical education? Do you think medical education? I think we are par or even better.
I think,
but
yeah.
in terms of technology and stuff,
Technology, we are almost there. We have the latest robots, and the surgeries which we do here, because our patients are more complex. Our patients come at the very end when the knee is really deformed, while the patients which are there, they come at the earliest instance of knee pain. Here the patients would try every trick in the book and try to avoid surgery. Some patients almost come crawling to us, and at that point the knee is totally deformed, and to get that knee into correct balance and painless, it requires real expertise, which I think even the Germans would be
They
very.
must be getting shocked with your
Yeah, they,
results.
when I showed my results, our patients which we operate here, they are shocked because they never see
See
such
such
gross
type.
deformities there.
Yeah.
So that is there, and robots which we have here are cutting edge. They are the same robots which are there available in Germany. It is not that they are substandard robots, and also the rest of the technology is at par.
You've
At
been
par.
to other countries apart from Germany for your sort of
I
ongoing
was,
training.
yes, I was in France for in Bordeaux for endoscopic training in spine. So
Excellent.
some patients with disc I do operate endoscopically, and for shoulder I was in Switzerland in a small place, Basel,
Oh, I
which
love
is at the
Brazil. Yeah,
confluence of
beautiful.
three countries: Switzerland, Austria, and Germany. So that training was also good, shoulder scopy.
So now, apart from your training, let's come to your present. All the training's done, everything is you at a level where most people would love to be. Samir, with the kind of work you do, the kind of results you obtain. What further? What are your goals? What are your career goals? What are your personal goals that I would like the viewer to know how young you are right now?
I am always 18 at heart.
All of us, all of us.
I am always 18 at heart. But jokes apart, I try to maintain my fitness. I do this Wim Hof breathing
Breathing.
technique. Have you read
Yeah,
his book?
yeah, that's
It's a
amazing.
fantastic, amazing book, and it really,
Exhalation is more
yeah,
than.
yes, it is. You try this every day in the morning, and you are fresh for the next whole day.
But
And
what is further for you? What do you achieve?
in
What do
career
you
wise,
career, family, social? What are you looking now at?
I would. My daughter is into medicine, so I discuss medicine with her every day. And again, she joined KM, my alma
Nice.
mater,
Yes.
and it was a great nostalgic trip down the lane when I dropped her in
Went to drop.
KM. Yeah. So it's the brick and everything is the same.
Same.
The structure is the same, and great nostalgic kick.
Right. About your hobbies, we all know that Samir is a very ardent reader. I mean, if you want to hold any conversation, you'll probably, any topic in the world, Samir will probably add a few more bits. And I know his favorite topics are Greek mythology, Indian mythology,
Yes.
his bed. I would like the viewers to know that his bed consists of books, and Samir's family, they're like close personal friends. Rajmati, Mrs. Pilankar, really complains that there are books under the bed, over the bed, pillows. I would love
I am a
the
voracious
reader.
reader.
And your comics, if you can tell us what
Yes, yes.
collections you've got,
I got
what do you like to read? Do you read e-readers or books? I mean, the viewers would be
I have been
interested.
forced to read e-readers, though that is not my first choice. I would rather read the real book, but e-reader is the way because you can't carry the entire book collection.
Also, your wife doesn't complain. If you switch on the light and I read, and e-readers are a blessing.
So
But what
someone
sort of
has
books you?
famously said that books are the windows to the soul. So I have many windows to my soul.
Yeah, I know. That's interesting. Comics, Amar Chitra Katha. I mean,
No, my
all-
favorite is Marvel, and
Marvel. Oh, I know
if there was a
Marvel.
PhD, I think there is a PhD in Marvel and DC.
the full family will get a PhD.
I will definitely get a PhD in that, and in Asimov. Asimov is my second
Isaac
favorite, and
Asimov,
Star
yeah.
Trek. If there was ever a PhD in this, I would be the number one in that.
So
So that is
just
my
for the
passion.
viewers to know, the family is very passionate about Marvel. If there is a Marvel movie in a theater, I think I'll ask them to put a picture of yours with Marvel T-shirts and Marvel gear, going and seeing a Marvel.
We dissect out the
and
entire movie.
in
threadbare.
Operation Theatre, when we talk, I think it's always, I'm so envious about Samir and his knowledge of anything. Orthopedic, he's a master. But apart from orthopedic, he's got this passion for lot of things that actually builds up. All the patients are probably getting. It'd be very interesting and philosophically if somebody can get a PhD in Marvel, PhD in either, is going to solve your shoulder pain as well as anything else. And I must
I always
congratulate you.
philosophize. I read a lot of philosophy. My favorite is Viktor Frankl. If you have read his book, Meaning of Life,
Yeah.
that is my favorite book, and Friedrich Nietzsche. So these are
Nietzsche
my
is difficult to follow. Humans being
yeah,
the ultimate.
try to fathom his thinking, decipher his thinking. But these are my top two philosophers.
So I would like the viewers also to know that Samir's got a very beautiful family. Rajmati Pilankar is a gynec consultant associated with Sujay Hospital. Two beautiful daughters. One is a physiotherapist.
Yes,
Almost passed out, Samir, now?
she's passed out, getting a training in Ambani Hospital.
Fantastic. And the younger daughter has just joined KEM. Uh, Tell us, as a family, how do you cope up with this balance in life? You're very
Balance.
philosophical with the work,
Yes.
and with you being so busy, how much time do you can give? I know you and Rajmati travel a lot together,
Yeah.
and the family travels a lot.
Yes,
Tell,
yes.
how do you keep that balance?
I call my wife as my better, not half, but 7/8.
Nice.
She is my
Nice.
better 7/8. She is the one holding the whole family together, and she is like the
Pillar.
rudder of the ship, and we are just around her. But I also give enough time to my family. I don't believe in quality time. So quality time, I feel, is a myth, and you should have length of time. The quantity of the time matters more than quality. If you might say I'm spending 10 minutes of quality time in a week,
That's not enough.
that is not
Oh, it doesn't
time
mean-
at all.
Yeah.
It is just a drop in the ocean. And many a times you are aware, we are just sitting around at our home, doing just nothing productive. We are just watching some movie or just reading, but we are together. That at the back of the mind, we know that we are all there at home under the same roof, and I think that matters.
So Rajmati
And
loves reading and
she-
traveling as much as you do.
She loves reading, but her interests are totally opposite to what I read.
Fictional.
More of romantic fiction,
Oh, nice.
and I read more of this.
She's found a hero. So how much do you travel? How much is
So
your travel time?
I make it a point that we have frequent vacations, and also more than that, we have frequent lunches and dinners.
Oh, that's nice.
With at least 3 dinners outside in a week. We make it a point at some good restaurant with the family.
Healthy dinners.
Healthy dinners are an oxymoron. But anything with the family, we go more for the ambience and the togetherness. I ensure that I give enough time to my family, because in the first 5 years when I was building my career, I had hardly any time for the family. But after that, I realized that unless you do, the kids just grow up very fast, and those precious moments are lost. So I did not want to do that, and now I give enough quality time to my.
I think that's the story of all medical professions. We end up finishing our studies by the age of 32, 33, and then there's this career building, which is difficult
Yes.
but exciting.
Exciting, yes.
But we do lose out on that phase of our children and
Yeah.
stuff.
So-
my take on Samir, that is that most of the times when consultants and we talk, we should give quality time. I think if you're looking at quality time, looking at children as a priority, we are giving. You are not giving, you are getting that time.
Yeah.
It's it's for good for us, and I'm sure it reflects into your care with patients. Because if I am not satisfied, but
That is
we
true.
camouflage it in saying that I am the giver, I am giving quality time. No, you are spending time, and that you gain, and you
Correct.
become calmer and stuff. Coming back to teaching, okay, and I know because of the time constraints that you've always had with your career, family, but you balance this time at Cooper Hospital when you were
Yes.
heading a unit.
Yes.
You have a reputation of being a good teacher, and people wanted to. I know some of my friends and their children always wanted to work with Samir because you gave them hands-on experience and
Correct.
stuff. What is your philosophy for teaching undergraduates, graduate students, and how do you mentor a young orthopedic doctor?
Mainly, we are dealing with residents who are first year, second year, and always I used to train them in the practical aspects of orthopedics rather than the theoretical, because theoretical they can read from anywhere, but the practical tips and tricks which we can give, that the books will not be having. So, particular ACL or a knee replacement, what all points we should look for to ensure that you get a very good result rather than an average result. That is what I taught my residents, and they are really thankful for that. And that is my firm conviction that you cannot teach a person anything. You can always only teach them to think,
Exactly.
and once you teach them to think about the problem, they can get their own solutions.
Solutions for
So that is that was always my thinking while teaching my residents, that you should think on your own, learn the principles, and everything else will follow. So it is something like fishing and giving the person fish. If you teach them how to fish, they will get their own fish. Yeah.
Very, very interesting. Now, what do you think of the present postgraduate teaching? Hospital, I think now,
Yes.
for some reasons, you are no longer associated, or
ये हम
you are.
लोग ये नहीं बोलते,
हाँ, इन्हें बोलते
ये नहीं
हैं
बोलते।
वो politically correct करने का.
इसको politically correct कर नहीं सकते.
Cut that.
It is-
I wanted to delve into something, that could be controversial.
It is a offside ball which I have to leave. Next question.
Okay, next question. So, we've always discussed, in Operation Theatre, me and Samir spend a lot of
Great
time.
time,
And
great time.
one of his biggest, I would say, talent and his achievement is sense of humor. And half the time we are laughing. Okay, and we must at this stage, I think, talk about Dr. Kale, who's a very,
course.
he's a colleague, and
He has been a life-changing person in my life,
So
without a doubt.
So,
And
with your-
and likewise, I think I have been a
yes,
life-changing in his
absolutely,
life.
absolutely. And now Dr. Kale is no longer here. I mean, he's in
UK.
in
He'll
UK.
be coming back
He'll
soon.
be coming back. So, what is your sort of take on you? You always believed that Bombay is the best city to work in, and that's your karma kshetra.
Yes.
What do you think? Would you like your children to go abroad and settle down? What do you think about Bombay as a working place? Your views on India as a career?
I think India is the best country in the world, without a doubt. I've been to most of the countries in the world, and maybe I will go 4, 5 days, 6 days at a stretch. But I would
Then you
always
miss
want
it.
to come back to Mumbai. Mumbai is the place to be. It is the vibrancy, the ethos of the city I miss everywhere I go.
Excellent.
So though Germany is very close to heart, Bombay will always be in my heart.
That's your working, that's your playground.
It's a very good place. Without
Would you
a doubt.
like your children to stay abroad and settle down, or what? Are you any ambitions?
I would not force them to my views on them, but I think they would like to be around us.
Because why I'm asking you is there are a lot of us professionals now, be it engineering, be it medicine, and you often find children, the primary, even in MBBS now, they start studying for USMLE in second year onwards, and you would like your children to be around you, study here, work here.
My daughter has made up her mind at the moment that she wants to become an orthopedic surgeon.
Oh, congratulations.
That USC has already ticked off from the list, because it is not possible, very difficult to become an orthopedic surgeon in US from India. So she wants to be here, and maybe the way we work and everything, they are at a very impressionable age, so they are really sort of impressed, and they want to do the same thing. But their views keep on changing. But I feel India is a very good place, and it is booming. At the moment, it is booming, and 10 years down the line, it will be at the very top.
That's great.
Yes.
I think we should all be as positive as you are about a country. So it's been wonderful to sort of get a wonderful insight into your philosophy of things, your sort of passion for hard work, and all those things that the viewers must have really enjoyed and learned a lot. Just a few parting messages, to the patient. What does a consultant or a doctor looking after a patient expect the other way? They don't know us. With the present system of being more transactional relationship that we have with patients. Any views on that? What do we expect from a patient? Second, I want you to just give us a brief message on our colleagues. We know that it's tough now for the other new doctors coming into this practice. It is much more hard work. Some brief 1 or 2 messages for your patients and for our colleagues, for life balance, for the purpose in life and stuff you would like to say as a parting message.
It's a handful. I'm not very sure whether I'm qualified to dish out
We'll find out.
philosophical advice to everyone, but let me try my best. So let's start from the last part. To my colleagues, so we say there is competition. Competition was always there right from Stone Age, when the hunter-gatherer went to hunt for the
Foraging.
lion.
Yeah,
there was
enough
always
people.
someone who was hunting a bigger lion, bigger tiger, and that competition was there. That is what spurred the people to improve. So when we feel a person, my colleagues, I have a fantastic rapport with
absolutely.
all my orthopedic surgeons, and they call me for when they
Their
are in trouble,
complications,
and
vice versa, we call our
vice
colleagues,
versa, and always we ask them for any difficulties or any advice which we want in a particular patient. The primary aim is always to get the patient fit and up and about. So that being said, if a person, particular so-called competitor, I don't call them competitor, is doing well, I am always happy. The idea is not to make his line shorter, but make your line longer.
Yes.
So that has always been my aim. And in Sujay, we have 10 orthopedic surgeons.
Absolutely.
And I have great camaraderie
great
with
time.
all of them. We have parties with them. And without a doubt, I can say that we have zero jealousy amongst each other.
That's
If Ravi is doing a case or Girish is doing a case, we are most happy for them. And I am sure they share the same thing about my surgeries. And so that is about colleagues. And about the budding orthopedic surgeons, I would say that never get tired. Tired is like happiness is a state of mind, tiredness is also a state of mind. You have seen me I have never complained about tiredness. I am never tired. So
I must just add here, when you say complain about tiredness, I don't think that tiredness, I think you never complained about anything. That complaint, the cribbing, which you would agree that the junior doctors we see nowadays
don't complain.
Always
think that it is your fault. Maybe it is not your fault, but always think in your mind
of solutions,
that it is, I can correct it.
Yes.
And rather than, you have read Stephen Covey's book about the control areas. So there is a control area where you can control, and there are things
something
beyond your control. So as long as you are doing things in your sphere of influence, you should be just happy.
Just increase, and
you should try to extend it, but things beyond that are not under your control. Like Gita says, you try your best, and whatever rest happens, you leave it to God. So that is my advice to
the junior doctors.
To the junior doctors, do your best, try your best and don't run after money. Money is a byproduct of your excellence.
That's important.
Try to pursue excellence and improve your skills, add more skills to your repertoire, and the everything else, fame, money, everything will just follow.
Be human.
Be human and use
Yeah.
common sense.
Use common sense.
Use common sense, which is uncommon
Any
nowadays.
sort of message you'd like to give? Because sometimes your patients, people whom you're treating, expect something from the doctor, but it is never sort of so far what we expect from the patient.
Yes.
So if you have some message for the patients who you look after, what should a medical profession sort of, are we supposed to expect something from the patient in their behavior or something?
So, I treat my patients as my family.
That's important.
So, I always call them as Ai, Ma, Maji. So that instant connection is there. And I was very close to my grandmother. So all these grannies, they just have a great wavelength with me. And I always make it a point to explain the whole issue to them, whether it is a fracture, knee replacement, and open it threadbare to them. What are the statistics of recovery? What you can expect from them, and the risk of complications, if any. And once we have a heart-to-heart conversation, they are very sure in their mind that even if something goes wrong, God forbid, doctor is trying his best.
Absolutely.
And all my patients have total faith in me. And that is what I want the juniors also to inculcate into their practice. Have a heart-to-heart conversation. Don't think of the patient as a consumer.
Absolutely.
And once you don't treat the patient as a customer, they will not treat you as a person who is dishing out some service.
That's
so
very
that is a partnership. I feel any surgery, anything which we do is a partnership between us, patient and God. And when three are together, you always get a good outcome.
That's well said.
So that
well
is
said.
my philosophy about patients.
So to just summarize,
and
I would say
all patients are good patients.
Yes.
I have never, in
Absolutely.
my entire life, touch wood, I have not come across a bad patient. All patients are good. Maybe there are some misunderstandings, but you need to iron them out. It is nobody's fault.
So ultimately, if I can summarize, what I expect from a patient is trust and faith, honesty.
It is a two-way street.
But when I expect, I will only get if I've got trust, faith, and honesty with them.
You are at a position of authority, and the patient is coming to you. Unless
So you have to build that.
Once you give, automatically it will
It's a
come.
two-way street.
It is a two-way street, but the street has to start from your side.
Absolutely.
Only then it will
No,
come
that's
from
very
the
well
other
said.
side.
What I want to do, Samir, now is just ask you a very
Rapid fire?
questions.
Oh, like Karan Johar. Do I get a hamper at the end?
We'll try. Have faith. So travel is luxury or adventure?
Luxury.
Europe or
Europe,
Far East?
without a doubt.
I'm asking questions, so I know most of the answers. So travel is with family or boys trip?
50-50.
Okay. Beach or city?
Always preferably beach.
Great. Orthopedics, would you like planned or elective surgeries?
Planned is elective.
Planned or emergency?
Planned is preferable.
Knee, shoulder, spine.
I think I will take all three.
Minimal invasive or open?
Minimal invasive, most of them.
That's the way to go.
Yeah.
So robotics or
Robotic.
robotic
Yes.
surgery.
That is the way for the future.
Insurance patient, non-insurance patient.
Insurance, because that takes away that equation from the
That's
money
nice.
equation from the relation.
You like being in operation theatre or doing your OPDs?
Always, if I had a choice, I would be 365 days, 25 hours in the operation
In
theatre.
operation theatre.
It is, you go into a meditative phase when I'm operating.
Same for me.
Same, yes.
It is just like doing yoga.
It is better than that.
Sujay or other hospitals?
Sujay, without a doubt. Sujay, let me just elaborate on this. Sujay is a family, and the comfort level which we get in Sujay, in OPD or in the operation theatre, it is just out of the world.
That's kind of
Out,
Samir.
it is not. It is a fact. It is out of the world, and all doctors who work in Sujay will vouch for it.
So nice, so nice. Friends, males, females?
Don't really make a distinction.
Friends are again school, work, colleagues.
School, I was very introvert. I made very few friends. I have mainly friends from the undergraduate, postgraduate, and
colleagues now.
Colleagues, yes.
Okay. Orthopedic friends or other branches?
Most of my friends are orthopedics, into orthopedics.
For
Because
hobbies,
orthopedicians are a different species. if
I
you
agree
know.
with you. More fun loving.
More fun loving.
I've got a lot of orthopedic friends and I like to be around orthopedic
So
friends.
there you are.
There I am.
rest my case.
That's Kale's, Dr. Kale's line. Hobbies, paperback, Kindle, reading mainly.
If I had a choice, I would have a mansion of books.
So you read classics or contemporary literature?
Not into classics. I am mainly into Asimov, sci-fi, mythology, archaeology.
Comics or non-fiction?
Both.
Great. I think you tick most of the rapid fire and I think
I
brilliant.
am entitled for the hamper.
Yes. Thank you, Samir.
Thank
And I
you.
think
It was a
deserve-
pleasure.
It is a pleasure. Really
I think we
enjoyed
should
this.
have this more often.
Absolutely. So this was a wonderful, informational conversation that I had with one of my colleagues. There were a lot of things I learned which I didn't know before about Samir, and now I can understand him better. The whole purpose of this podcast is for you people to know your doctor better, see exactly where they're coming from. We will try to improve on our conversations, but give us your feedback, and I hope you all enjoy seeing what we've tried. And I'll thank you and the entire MAD team for doing this for us. Samir has been kind enough to give us time, and it was fun doing this podcast. Thank you.